some therapists and some of my best mates, sports therapists, they'll run their athletes very early. I don't run my athletes until they can do the hopping progressions, okay? So the fact that they've done the hopping progressions and they've done them at 70, 80, 90% of their perceived max, we've put a lot of load through these tissues already. So that's why then we can, in the second running session, we can get them up to 80, 90%. In professional sport, if you've got GPS, if you've that luxury, then your athlete, they may hit 85, 90%. They mightn't quite hit the 90 in the second session, but they might be close. And again, I just use the perceived. If they're obviously doing it, way faster than they should be, then we might have to have a word with them, okay? But again, overall, most people, when you say, okay, run 50% of what you perceive is your max, then most people can figure that out, okay? So in the private practice, we'll get our patients, we'll give them the handout, and then they'll go away and obviously do this themselves. They can update us via email or whatever it is, or then we'll see them in the next session, we can progress them again. Usually when we've hit 90% day off, and then I'll usually then go and start at about 60% for 4, 70% for 4, 80% for 4, 90% for 4, 100% for 4. And then what I call 110% is where we give them some kind of cue that they have to react and they have to go without thinking. And again, in that last 110% block of 4, we're really looking for that thoughtless, fearless movement. When I clap my hands, I want you to sprint, I want you to accelerate, and I want you to go without any thought, any thinking, any hesitation. And we're really looking for that with our patient so that they are genuinely demonstrating the thoughtless, fearless movement. Obviously, our deceleration progressions, we're increasing our intensity as well. In the first block, we're going to hit up to 70%. In the second running session, we're going to hit 90. In the final session, we're going to hit flat out deceleration. If it's an ACL or a long-term injury, then you might want to spend maybe a week at 70%, a week at 90%, and then a week at working up to the 100%. Obviously, you decrease the volume there. So all that you're doing with these running progressions, with the template that I'm giving you, is ultimately it's just a graded exposure running program. If the conditioners are in sport, or if your athlete wants to condition, I like them to be able to hit 90% of their max speed before we do the conditioning. So again, make sure that they can hit 90, then bring them back down to about 70. If you're using MAS or anything like that to gauge the conditioning, then just make sure that they're hitting at about 70%, and you'll be pretty good, okay? So that's the main running progressions that we use. Keep it very simple. It's just a graded exposure to the running progressions. Then obviously to do that, then they need to be able to train, and you can use whatever objective markers you use. People always say, oh, what about this? What about this? If you do your job well, they should be able to pass all of your return to play objective markers. So whatever markers you're using, whether you're using some rate of force development, or you're using some dynamometer, or you're using some isokinetic testing, if you've done your job well, they should be able to pass all of these tests. So that's the running progressions. In the next video, I'm going to show you the deceleration progressions, and then we'll show you how to put it all together.